What's up, guys? We are live. What's up, guys? Welcome back to the Ange TV show, guys. Today, we have backstage a very, very special guest, guys. And it's a first on the Ange TV show. We have a quote-unquote health professional waiting, okay, guys? So I'm very, very excited. I can see her backstage. She's ready to come on. A bit nervous, but she's ready to come on, guys. We have none other than dentist, good friend, lifetime friend, Miss Dr. Laura.
Hi.
Hey, how are you, Laura? How are you doing?
I'm doing good.
You're doing good. Good. Erica's in the building. She's here. What's up, Erica? Erica's my girlfriend, for those of you that don't know. Jerry's also in the building. Laura, how you doing? How you doing? Hot day today.
Hot day today. Yeah, it's been it was an exciting day today.
Yeah, it was long day, and you're doing it from your house as well, which is understandable because it's really hot, you know, like to do it in your scrubs and everything.
Yeah.
So Laura, for the viewers that don't know you, why don't you tell us who is Dr. Ianella?
Hi. So my name is Dr. Laura. Most people just call me Laura.
Yeah.
I work at a dental office in St. Leonard in the east of Montreal.
Mm-hmm.
I've been working there for the past 2 years. I graduated 3 years ago. I did a year residency in Rochester, New York. So that's more my professional background. My alma mater is, I did my dental school at University of Montreal.
Okay.
And my family background is that my dad is also a dentist.
Exactly, yeah. Long time. He's my dentist, guys. So in case you don't know, guys, Laura is my dentist now. But I grew up with her dad as my dentist, the late Tony Ianella.
Yes.
He's an amazing guy. I've known him my whole life. From when I was really small and I was nervous to go to the dentist. And then he had to tell me that he was going to rip one of my teeth out with something that looked like a bird pecker. So listen, we go way back, you know, with Laura, and it's crazy because now I used to see Laura. She was small, and I believe you didn't want to be a dentist at first, right?
So yeah, I was when I was small, I didn't really I thought about doing a lot of things, a lot of technical things. I want to be a police officer. I want to be a mechanic, like car mechanic, like a whole bunch of different things, like off the wall things. And then my career just aligned with my dad's, and it was, and that's the true story behind it.
Now, like, okay, we know that the schooling. How long is the schooling to be a dentist?
So typically, the short of it would be about 4 years. There's actually some schools in the U.S. that are actually 3-year programs.
3 years.
Yeah, 3 years. But typically in Quebec, after CEGEP, you're looking at either 4 or you're looking at 5 years minimum.
Okay.
And most people do a bachelor's of science,
Really?
or some sort of bachelor's before getting into dental school. So I did 2 years at Concordia, and I continued at University of Montreal, and it's fine.
Wow. So listen, when you're not busy working with your patients, are you still studying, or is there something else you're trying to get? Maybe another like accreditation, or?
So yeah, what's nice about the field is that it's never ending, right? There's like always continuing education. Presently, I did some courses in Florida. I did some, like, there's so much you could do. It's never ending. You could also some people actually choose to specialize. I chose to stay in general dentistry. And even within the general dentistry, if you want to like subspecialize into like different areas, that could happen too.
Nice.
Yeah, and there's conferences we can go to. It's really fun, actually. Some people like they.
And also, you could also teach dentistry, right? Like your dad, he teaches at McGill, right?
Yeah. So my dad teaches practice management, which is the business aspect of dentistry, which is actually really important because.
Interesting.
Yeah, because we basically are most educational background of anybody going into dental. Typically, you do a bachelor's of science and then you continue to dental school. So we get very little business experience. So he took that aspect. I myself, I'm actually at McGill. I was at McGill this morning. I came on Tuesday mornings. I'm a demonstrator, so I supervise the third and fourth year students on McGill.
Nice.
Yeah, so it's fun. It's good. It's a good way of giving back.
It is. It is. And you know what, Laura, I commend you for what you do. It's not easy. And like I said, all frontline workers, healthcare workers, you guys are the best. Like I said, it's not an easy job. You got to be, to a certain extent, you got to be precise too. You can't really be nervous when you're working on your patients and everything. So it's like, I commend you really. So like I said, what are your hobbies, Laura, when you're not working with patients with teeth and all that stuff? What do you like to do on your pastimes? Do you have any hobbies, hidden hobbies that we don't know about?
So yeah, I'm actually a runner. I'm training for the Berlin Marathon. If I'm able to travel, if the travel restrictions are lifted, I would like to go. I'm training for it's in exactly 16 weeks in Berlin, Germany. I'm training for that marathon.
Yeah.
So that's what I do on the side. I've always been into sports. So when I was a kid, I played a lot of soccer. I played very competitive level. I was actually a goalie.
Yeah.
So yeah, I'm like a big sports fan. Mostly soccer though, mostly soccer and running.
Nice.
Tennis. Also, I was in ringette for a while. I did a whole bunch of things.
Me. So you're very sporty, and that's good. That's good. Listen, Laura. So how did your passion for dentistry start? You just woke up one day. You said, "Oh, the tooth fairy." Like I mean, like how did you just come out of? Because you didn't want to do dentistry. How did the passion start?
So one thing. So I'm happy you asked the question because, like you mentioned, my dad has been your dentist for your whole life basically, and
Yeah.
there's a lot of stories like that with his patients. He's been able to develop rapport with a lot of his patients, and a lot of dentists will tell you this. And I think it's one of actually the most charming aspects of the dental field is the fact that you're able to connect with people and like basically follow them through their lives.
Yeah.
In some way you become their confidant, you become their friend. Uh, you know, let me tell you something. We're like, believe it or not, we're one of the first people to find out, like when someone's pregnant, for example, because we have to ask, right?
Really?
We find out all these fun things, or
Yeah.
we find out, everything, and what's great is that you build a clientele or a patient pool, and the patient pool grows with
Yeah.
a number of years of practice, and you get to know that patient pool really well.
You
And
build a relationship with your patients, right? Like I said, me, seeing your dad is like an uncle to me. You know what I mean? Like I said, I've been seeing him since I was yay big. He always says, "Hey, what are you doing in school? Like what's going on in life?" It's amazing. But by the way, Pat has a question. Pat Ianella, what's up, buddy? He says, "Does your firm accept direct dental insurance payment? Where are you located as well?"
So we're located in Saint Leonard, so in the east of Montreal. This is actually a big firm, direct pay in dental insurance payment. So there's a movement within the dental field. I just want to explain this question a bit, if I may. There's a movement within the dental field to get away from we call that benefits. So to go more towards a what they call direct payment,
Yeah.
because once that, and the reason for that is because it gets away from the dentistry.
Yeah.
Um, the insurance company has is something that's specific to each patient, and I believe what he's trying to ask is some dental offices, what they do is they accept payment, they ask for payment right away, and then they give the patient a form to send to the insurance company, and the patient gets reimbursed afterwards from his insurance company. Usually in like it's faster than the dentist reimbursement, so the patient actually gets reimbursed before the clinic gets reimbursed. Um,
Okay.
that's the background of that question.
Okay.
So yes, so there is a movement to go away from that, and we want to try and get direct payment from the patient. And what this
Okay.
allows to do is it also allows the patient to be more aware of the fees and more
Mhm.
aware of his own care.
Nice, nice.
So we
Uh,
yeah.
so in other words, to answer his question, what was his question? Let me go
So
check.
do we
Yeah. So do you accept direct dental insurance payment?
um so it's so insurance payment is never direct. That's the so the insurance payment is never direct. It's always an indirect way. We always like so when the claim is sent from the dental office, there's
Yeah.
always
A delay.
delay. So
Yeah.
there's a delay of about a month or two between
Exactly.
the procedure and the
It's because I believe Pat was telling me his insurance covers 100%. I believe it was what he was telling me. So maybe
Yeah,
that's why he was
vary. It could vary. It could vary. The reason for that is because it becomes like this weird like game.
lingo. Yeah, yeah, you have to exactly. Yeah,
So we just want to focus on the care,
yeah,
and
exactly.
so yes. So in our office, we're trying to get away from direct insurance.
Hmm.
We're trying to get more direct payment from the patient because the patient will get reimbursed within a couple of days, whereas we'll probably get reimbursed within months. Uh,
Exactly.
Always because at the end of the day, it's the patient's insurance. Right?
Yeah. Thank you for that, for telling me how you got started in dentistry. But listen, like, I mean, every child, whether their parents could afford it or not, let's be honest, because one in every four people, okay,
Yes.
in Canada, one in every four, 25% of
Yeah.
Canadians cannot afford dental insurance, or they just do not want to go to the dentist. So, put it this way, one in four Canadians do not go and see a dentist on a regular basis. It's pretty alarming if you think about it. Like, what are
It
your
is
thoughts on
hard.
that statistic, Laura?
It is hard because as a dental professional, we're trying to become more. We want to. We're a necessary dentist. Dental care is is within. It's part of the human. Like it's part of the healthcare in general. So,
Yeah,
so for example, not seeing a dentist is like not seeing a family doctor. And for a lot of people, they also don't have family doctors. That's another controversy by itself.
yeah,
Um, so to come back to the question, it's scary. It is. It's scary. As a dental professional, it's scary that 25% of people do not want to see us. I think that actually the percentage might even be higher. Um,
really.
yeah, the percentage might actually be higher people without dental insurance. But that's another
Yeah.
controversy by itself. It's scary.
So like the reasons why people will not go see a dentist, okay? One is probably is because they don't have the insurance, right? Not everybody has the insurance to cover
Yeah.
it.
So
So
maybe not insurance, but the finances.
the
It's expensive.
finances, financially they can't afford it. Some people are just scared, right?
Yeah.
Some
There's a
people are scared. They don't know what to expect, or maybe they haven't been taking care of their teeth, and then they don't want to come on and
It
then
could
be
also be a
because
bad experience, you know? It could be a
I'm gonna say something, Laura. Like
yeah,
when you go to a dentist, okay, and
yeah.
you haven't been taking care of your teeth, it becomes this like personal thing of like you feel like the dentist is almost like picking at you, being strict, quote unquote. Like it's a bit, it hurts a bit, It hurts to hear these things, but at the end of the day, you have to be transparent and you gotta tell it the way it is, right? So, but
Um, so I don't think I think people are just they're scared of being judged, but that's
Mhm,
not our role at all. Our role is
mhm.
not to judge people. Our role is to provide care, and
Yeah.
that's the main goal, right?
Uh-huh.
But I think when people what they're worried that since they haven't been to the dentist, I think Maria Kuch has a question. Since they haven't been to
Maria Kalucha says, "Do you enjoy working with kids?"
I actually really do. I think we have a question about that later, no?
No, I was saying the question was, why are children scared of going to the dentist?
So what? So why are children scared? So this is
Yeah,
because it's a novelty, right, for them.
yeah,
Going to the dentist. It depends on their it depends on their past experience. A lot of parents come in and say, "Oh, he had to have a surgery when he was really young. It scared him. It scarred him." So there's all that um, and this is very important. Children's first experience of the dentist also molds or shapes their future other healthcare professional experiences, right? So a lot of dentists choose not to treat kids because they don't want to. It's almost like a guilt, right?
Really?
If they have a bad, if the child has a bad experience, then they're also going to be afraid of maybe going to see a family doctor. They're going to be scared of healthcare in general. So a lot of dentists choose not to be have that kind of responsibility, right, or that guilt. I'm not one of those dentists. I believe that I try to treat as best as I can. I try to have a positive attitude with kids. I
Yeah.
think that's the most important. Trying to have a positive attitude. Try to also calm the parents, right? A lot of times parents are a little bit nervous about the procedures, and that sort of
Hmm.
projects onto the child.
Yeah.
um, but yeah.
Pat said some dentists have a financial plan, financing plan. If people can't pay the full amount, I could be wrong. So do you do that? Do you do financial plans?
Um, yeah, yeah, we do to some degree.
Okay.
Uh, this is also on a per like a this is depends. It's on a case per case basis.
Okay.
I wouldn't say on in general. Um, yeah, you see,
Does it happen often that somebody says, "I need to make a payment plan because they can't afford, I don't know, a crown, a major surgery, or whatever
well, that
procedure
goes
maybe"?
back to our previous statement, right? Like about people are scared of being judged when they haven't gone to the dentist. It's also goes back to
Hmm.
that. The more we avoid going to the dentist, the more problems get more expensive, right? What
Yeah, I
started
know.
what started with a small cavity becomes a bigger cavity or a carie. Then there's a need for a crown, a root canal. Uh, yeah,
We have a question here, and you know what? I need the answer to this too because I hear people talk about it. I don't even know what it is because I never got one.
yeah.
Why do people need root canals? What is a root canal? Why do we need one? How much could it cost?
Uh, so the root canal procedure is when there's a big cavity or commonly known as a cavity. So or
Yeah.
a carie that's caused by bacteria. So the bacteria infects the tooth, causes decay. So
Okay.
decay is what we commonly call a cavity
Yeah.
in layman's terms. The cavity becomes so deep it affects the nerve. So the nerve within a tooth, it contains a blood vessel and it contains nerve ending, right?
Yeah.
So the nerve being in an enclosed space, that is the tooth, starts to throb, and it starts to inflame, and eventually
Okay.
it necroses. So those are
Oh,
all different symptoms. So that's when you start getting pain because there's inflammation and there's what we call pulpitis. Um,
okay.
these are all terms we use when we diagnose a root canal.
Okay.
Um, so yeah,
So in other words, a root canal, does it mean that
yes,
your tooth is basically dead?
not necessarily. Uh,
Like is it like okay?
It
How do I
depends on the
explain this?
diagnosis. So it depends on the diagnosis. A tooth
Okay.
could be inflamed to a irreversible state, and that
Oh,
would need
okay.
a root canal.
All right. Cool.
Yes. So it depends on the depends on the diagnosis. It doesn't necessarily
Yeah.
mean that the tooth is dead. It just means that the nerve inside the tooth is inflamed to a point where it's causing itself to necrose.
So what happens if you don't get that root canal? The tooth it'll just basically come off, or like it'll
Uh,
decay.
that's a fun fact. I did my residency in Rochester, New York. So
Yeah.
in New York, their public health is actually in terms of dental, and the dental public health is actually very good, much better than in Quebec.
Really? Okay.
Yeah, I say that without any political allegiance. I'm just saying, I'm
Yeah.
stating facts. Like they cover much more. They cover root canals, they cover crowns until the age of 21 years old. There's a lot more coverage.
Yeah.
But some people do not qualify for this care. So they fall into this like middle ground where they have Medicare, which is public health care, which is like medical care, but they don't have dental insurance or Medicaid, which is dental insurance. So a lot of times these patients would end up at the emergency room, most of the times late at night, because they have abscesses. So if a root canal is not taken care of, it causes infection, and it could cause what we call an abscess, which is swelling, a facial swelling. So at that point, the resident on call, which was me for a year, would get paged, and we would have to incise and drain the infection.
Really? Maria said, what toothpaste do you recommend for sensitivity? Like, I have sensitive teeth too.
So typically, without any allegiance to any company, Sensodyne is very good for anything. So Sensodyne, Colgate, they all have anything that says for sensitivity is typically good. You just have to look at the instructions, because some toothpastes are applied directly on the teeth. Some are used to brush with, but they need to be some have a specific application instructions. But anything Colgate, Sensodyne, anything that typically you want to stay away from anything that is whitening, because whitening is very abrasive on the teeth. So a toothpaste that is considered whitening could be a little bit more abrasive, could actually increase sensitivity. Somebody with sensitivity problems would probably stay away from.
And that's one of our questions: are teeth whitening products such as bleaching and stuff like that, is it effective?
So anything that is officially let's talk about the typical. If we go to the pharmacy, we see white strips, right? Crest white strips. They work well.
Really?
I have nothing. Yeah, they work well. You can get either get the strips at the pharmacy. You could also get something custom made at the dental at your dentist. So bleaching trays that are custom fit to your teeth. Those have a better fit. They cause less gingival irritation because. I'm sorry, I just saw the question pop up. So something that's more custom fit will cause less gingival irritation, and we'll have less gingival. And the gel that typically is given at the dental office usually has a included in the gel is the whitening agent, but also a desensitizing agent. So one of the main concerns, post-op complications, or I would say maybe risks, are dental sensitivity after whitening. As it plays around with the tubules and it causes sensitivity of the little nerve endings. So the white strips are very good. And when I mean white strips, I mean like the little
But I have a question though. Is there like certain products that we have to look out for? Like, why is some toothpaste more expensive? Should we buy a bigger tube that might be a bit more expensive than a smaller one? Like, you know what I mean? Is there any difference between that? Because I see a lot of price differences. If it's cheaper, the toothpaste, does that mean it's not as good?
Not really. I mean, So this depends on your specific needs, right? Maybe somebody would want something more something more whitening because they find they have more stains. That's more abrasive on their teeth. Maybe somebody with sensitivity would require more of its desensitizing, a desensitizing toothpaste. It really depends on your particular needs. I would 100% go with something that has fluoride. I know this is an area of big debate. Among my patients, they say fluoride is toxic. In very high quantities, yes, fluoride is toxic.
This is a really good question, Laura, because there's a lot of questions coming in. But Maria said, is an electric toothbrush good? Listen, I used to have an electric toothbrush. It was like an army electric toothbrush. It was my favorite toothbrush I ever had, just because it was cool. I go, and then you don't even have to go up and down. You just go, and it cleans your teeth. But are they effective? Are they better than you sure?
I wouldn't say that they're better. For somebody with dexterity issues, I'm thinking of maybe an elderly population. Something electric might be easier. And one of the big concerns, one of the big differences between electric and manual toothbrushes
Mm-hmm.
are typically manual toothbrushes. We're able to control how much pressure we apply. With
Yeah.
the electric toothbrush, the pressure, we should really just be applying it on our teeth and letting the electric toothbrush like roll or do its thing. We
Yeah.
don't want to apply. It's not like when you have an electric toothbrush, you're not using it as a manual toothbrush, and you should be avoiding altogether horizontal movements like I did. But like you should just let it apply it onto your teeth and let it work.
Oh, really? Okay.
Whereas,
That's interesting.
yeah, I
So,
don't.
yeah,
Sorry.
Jerry
I was,
said, should flossing be done daily?
yes, it should actually.
Is it like mandatory? Is it really a big deal if you do it every 2 days?
So there's a reason behind this madness, right? So
Okay.
we tell people to brush twice a day, and there's a
Mm-hmm.
scientific reason behind that. Because typically it takes so every time you eat, there's a what we call biofilm that accumulates on your teeth. This
Wow, what a word.
biofilm, right?
Yeah.
This biofilm also it accumulates elsewhere. Also, it accumulates in our arteries, whatever. Biofilm is
Wow.
like a very general term. But on our teeth, there's biofilm that
Mm-hmm.
that occurs. The biofilm becomes plaque. Plaque becomes tartar, and there's a timeline to all this. Plaque is more a decent. It sticks more to your teeth than biofilm. So biofilm can easily be brushed away, whereas plaque it sticks to the tooth surface. So the reason why we recommend brushing twice a day is
Mm-hmm.
because it takes 12 hours for the biofilm to become plaque.
Ah.
So by brushing twice a day, we're avoiding that transition from biofilm to plaque.
When it becomes plaque, what does that mean? It means you can't brush it off?
No, exactly. So then when it goes from plaque to tartar,
Yeah.
typically you need professional instruments to
Wow.
remove it. That's why a lot of people need regular dental care, right?
Unbelievable.
Yeah.
Okay, but it's not like if you don't floss every 2 days, you're gonna get a cavity guaranteed. Like,
No. But for example, somebody who has a filling.
yeah.
So somebody who's had so we say fillings or who's had a cavity, a decay, so has a
Mm-hmm.
cavity and has it filled by a dentist.
Mm-hmm.
The tooth is actually more at risk of redeveloping another cavity, right?
Really?
Your
Okay.
tooth, once your enamel or tooth structure is gone, there's nothing that could replace it. Enamel is the strongest substance in the human body. There is no material that would, how do I say this? There's nothing replaces your natural enamel. So once it is gone, the tooth is actually not as strong.
Mm-hmm.
So typically we have to, so with people who have fillings, already there's an issue. There's most of the time there's a oral hygiene issue, right? You
Yeah.
don't get cavities for no reason. There's usually a lack of, most of the times, unless there's systemic issues, but most of the times there's a lack of oral hygiene. Once we place a filling, the oral hygiene actually needs to increase because the tooth is actually more fragile to recurrence of cavities.
Yeah.
So to answer your question, for somebody who has cavities, which I know you have, Ange, or who has fillings,
Oh my god.
yes, you should actually be increasing your oral hygiene because
Yeah.
tooth is not as strong as it used to be, right? Nothing replaces the enamel.
Okay, so that's why when I sometimes I floss, my tooth breaks. Like I find a piece of my tooth.
Um, that shouldn't happen. That
Well,
shouldn't happen.
I don't know. Like, well, you know what? That's a good question too. How come when I floss, sometimes a piece of my tooth comes out? Like,
So that shouldn't happen. If something is coming out when you're brushing or flossing, it's because
yeah.
there's an issue. Like there's a
Okay.
pathology. So if there's either decay, like I said,
Okay.
there's maybe bruxism
Could it be
happening.
with the flossing? I did it too strong, or I'm cutting a piece of the tooth off.
there is a thing. There is a thing as aggressive flossing, right? Because
Okay.
um, uh, so this comes back to my electric toothbrush analogy. If you're using an electric toothbrush like the way you use a manual toothbrush,
Yeah.
the electric toothbrush has more power, right? So yes, you'll be removing tartar or you will
Hmm.
plaque or whatnot, but
Hmm.
you're also it's also harmful for your gums.
Really?
So you don't want to floss. You want to when you want to floss carefully, and
Hmm.
you want to make sure you want to watch out for the anatomy, right? For
Yeah.
the anatomy of the tooth, you want to watch out for the anatomy of the gums because we don't want to
Absolutely.
like crush our gums when we floss.
We have a lot of questions here. Maria has a few questions. First of all, she said, "What's the role of a dental hygienist?"
So the role of a the dental hygienist is an important. So when it comes to a dental team, at our office, we have three secretaries, a hygienist, and we're three dentists. And we have three dental assistants.
Yeah.
So the hygienist plays a very crucial role because she takes care of the technical aspect of the recall exam. So the recall
Okay.
exam is every 6 to 9 months, depending on patient's needs. And the dental hygienist does the technical work of removing any tartar. They're allowed to take X-rays, so they do so by radiographs. I mean, so they're allowed to take radiographs. So they do that. They do that technical aspect for us, and they what that allows us to do it allows us to do an exam, which is much more thorough because the teeth are clean. We're able to look. We're able to see if there's any pathologies. We're able to diagnose. So a hygienist are they're very good. They're healthcare professionals
Yeah.
that take care of the technical aspect of the what we call recall exam.
Okay. We have a few other questions. Is
Yes.
chewing gum good for your teeth? Because that's like actually, let's talk about facts. We might as well, since we're doing that right now. Where is it that I have here? Do I have it on my list? I believe we were going to talk about facts, right? I don't think I have
Yes.
it here. But myths and facts about oral health. Okay,
Yes.
is chewing gum good for your teeth? Yes or no?
I would say yes. So typically, you want to stay away from gum that it has added sugar, but gum that actually has what we call xylitol. So there's another word for you. Xylitol, Zylitol, xylitol.
Yeah.
That is actually it's a type of sugar that's found in some gums that actually reduces the bacterial that has been shown in some studies to reduce the bacterial count of specifically bacteria that cause dental decay, so cavities. But other than that, uh, chewing gum also stimulates saliva, right? So saliva, what it does is that um, it so saliva is like the uh, it makes so saliva is like a lubricant within the oral
Mhm.
cavity, and it stabilizes our pH. So it keeps the
Okay.
pH at a normal level. So when you eat something very acid or even something basic, the saliva is there to bring the oral pH back to its normal level.
Interesting.
So yes, for
Another question we have is, when do we need implants?
uh,
So implants would be basically getting rid of the tooth and putting a new one, right?
yeah, so implants have actually changed the dental world quite a bit.
Hmm.
Where like teeth that used to have a questionable prognosis,
Hmm.
we used to try and save them as much as possible because then after we're trying to do what we call these herodontics. So we're trying to save teeth and do whatever we can. With implants, it gives us another option, not necessarily for teeth that have a poor prognosis, but for teeth that otherwise, like for it allows us to replace teeth um, that are extracted
Yeah.
or removed.
Maria said, should kids be seen 12 months at the dentist?
Um, So the RAMQ, so the state medical, how do I put that? The the state insurance,
Yeah.
state care offers a dental exam for kids under 10 years old every
Really?
6 months. Yes, so
Okay.
it's covered by the what we call the RAMQ,
Yeah.
or state insurance.
Okay.
Um, as dentists, ideally, we would like to see them more often, especially kids, because kids.
Pat said the same thing. He said, "Do you recommend dental cleaning twice a year?" Absolutely, right?
I do. I really do. I think you should be seeing your dentist to avoid any bad, to avoid anything like
Yeah, because look, I put it this way, guys. What she's trying to say is like, you're trying to avoid something that's maybe could be like $100 to be something that's $1,000 and paying for you.
yeah,
You know what I mean?
if you want to put a financial aspect to it, but it's also it's also all the work behind it, right?
Hmm.
Wouldn't you much rather even do something preventative? Like,
Yeah.
wouldn't you like to, for example, be aware of what we call incipient carie or incipient decay, so that you could prevent it? Use a higher fluoride toothpaste, for example, or
Yeah.
increase your flossing to avoid having to fill the tooth, or even avoid having to do a root canal, right?
Yeah. So we have a question that basically we're going to talk about anyways. What are the risks of dental procedures? Now, the question was, can you explain the implant procedure? So, I
Yes.
mean, I guess you could fuse that question with this question. Tell us about your procedures. What are the risks of the procedures as well?
So when we do fillings,
Hmm.
um, fillings can be diagnosed. They're diagnosed clinically, so we have to actually look at the teeth, but they're also diagnosed off radiographs. Most of the times, the pathology, the decay is actually more important or deeper than what is seen on the radiograph, right? So some risks, dental procedures, are what we call pulp exposure. So when there's a cavity that's very deep, that we have to go clean out manually with either a high speed or a slow speed, we could be causing it could be going right into the nerve, and typically we'd warn the patient ahead of time because we'd plan for it on the radiograph.
Hmm.
But sometimes we get surprises.
Yeah.
Sometimes the cavities are actually not the fillings are actually not that deep, but people still get some post-op sensitivity.
Mhm.
Um,
So we
especially,
have an interesting question, Laura.
yes.
What foods should someone avoid to avoid cavities?
So your typical juice, that's a big one.
Why? Why is juice? Because it stains your teeth, or
Uh,
what?
no, so juice, what it is that most juices are high in sugar, and also
Absolutely.
very acidic.
Okay.
So high in sugar, we're feeding the bacteria that cause decay.
Hmm.
And also when I talk to the saliva, we're causing demineralization. So demineralization is when your saliva, when your mouth or your oral cavity becomes very acidic because you
Hmm.
ingest something like a juice that's very acidic, and it causes demineralization of your teeth.
So juice is the worst thing to
Uh,
drink.
yeah,
Coke, soft drinks.
Coke as well, because Coke, especially if you're looking at cola, for example,
Yeah.
is high in sugar, and it's also um, because it has that what is that word? It has the what is it? Like it's
Gas.
has,
Coloring. Like coloring? No.
no, not coloring. It has the uh,
Caffeine.
no, it has uh, oh my god, I have a
Syrup. Syrup.
it has a sparkling aspect to it.
Okay.
That is usually to get that the carbonization. There we go.
Carbonization. Okay.
So carbonization makes a beverage very, very acidic. So
Okay.
Coke, not only is it high in sugar, but it also has the carbonization. We have like a dual acidic effect on your teeth.
So also salt, I'm guessing, is not good.
Salt, salt is just not good for other reasons, but no, salt I wouldn't. Salt's not bad. It's not bad for the.
Adrienne is asking, what inspired you to become a dentist?
So I had a role model. I've had a role model that's very close to me. My dad. He's actually inspired several. Funny story. He's actually inspired several people to become dentists.
Okay.
But anyways, yeah. So my dad.
Nice.
I saw him. I saw his practice. I actually grew up in his practice. Right after school, I always would go see him.
Yeah.
I would go say hi, and I would see him. I really appreciated the rapport he had with his patients.
So you
And
grew up in a family of one dentist. Do you have any uncles that are dentists?
no, so just my yeah. So my mom's a nurse. My dad's a
Okay.
dentist.
So a health background family, if you want to
Yes.
say that. Interesting. Dark Resident is giving you a round of applause. Thank you for being a dentist and helping so much people.
Oh, thank
That's
you.
great to hear. Uh, Maria said, "Why do infants develop nursing bottle cavities?"
Yes.
Interesting.
So I think the pediatricians are very good at this because I've been educating my parents that come that are have newborns or that have babies. A baby should not be falling asleep with milk,
Really?
with a bottle. They shouldn't be falling asleep with a bottle because the bottle tends to pool, the milk tends to pool in their mouth and it causes cavities. And it's the kind of cavities that are on all the front of the teeth. So typically, a baby should not be falling asleep with a nursing bottle.
I did not know that, but thank you. I won't make my future kid sleep with a bottle in his mouth.
But the pediatricians are very good at this. Actually, they're very good at educating because when I
Okay.
speak to the younger, to the parents of newborns, they're
Mhm.
most of them are pretty much aware. They're also aware that they shouldn't be drinking juice. For
Yeah.
other reasons, right? It's high in sugar. We want to like avoid that, like uh,
Build up of tar and stuff like that.
no, not just that, but like for like that glycemic index of
My
like
God, these like Chinese to me, guys. Oh my God.
which fluoride mouthwash do you recommend? So once again, it's not too. It's just because I was looking at these. I was looking at the floor. I was looking at the mouthwash this weekend.
Yeah.
Um, I really like um Colgate 3D White because not only does it have fluoride in its mouthwash, it also has hydrogen peroxide, which is very good for the gums. So before we were talking about whitening agents, and
Yeah.
I mentioned the white strips. I don't typically recommend a whitening toothpaste. I find it very abrasive on the teeth.
Hmm.
But a whitening mouthwash, not for its whitening effect per se, but Colgate has a 3D white, which like again, it's not to mention and not to mention a specific company. It's just because I was looking at that. So typically, you want to get a mouthwash that does have some fluoride. It's not all mouthwashes that have fluoride. You would want to avoid any mouthwash that has alcohol because alcohol.
Oh, okay. So that's why when you go to the dollar store, it's cheaper, right?
Yes.
Okay.
I think even the dollar store now they have.
Fluoride. Okay, so you got to look for fluoride.
Yeah.
If it doesn't say fluoride, it's not good mouthwash.
Yes. No. It's just fluoride is a it's natural. I like its protective effects and
Yeah.
on the teeth, and also like I said, hydrogen peroxide is also very good. That's also usually it's in the medical like in the medical ingredients as well.
Yeah. But you
As well.
said alcohol is not good in the
Alcohol
mouth.
is not good. Yes.
Why isn't it good alcohol?
Well, for people who have dry mouth, it has a tendency of drying out their mouth even more. There's been
Okay.
some studies. Now, this is like there's like one study that has shown there's a higher risk of oral cancer with alcohol, but this like we're really looking at one single study, and it was like a very particular study. So people have just like ever since that came out, people are just like as dental professionals, we have just stopped recommending alcohol mouthwash.
Yeah. Adriana says, "What is your favorite part aspect of being a dentist?" So I guess we could fuse that question with this one over here, which is, what is the typical day of in the life of a dentist?
Yeah. So typical day. So my typical day, I usually wake up at around 5 o'clock. I usually go for a run. I try to get in at least 2 or 3 runs per week. And then I'm off to the office. I try to get in at usually 45 minutes before. So we start at 8:30. We try to get there 45 minutes ahead of time to prepare. We'd like to have what we call a morning huddle with the team, because, like I said, there's a dental team right behind this. We don't work alone as dentists. We typically work with an assistant. We work with a big staff, right? And very highly trained staff as well. So we work with a assistant, a dental hygienist, and we work with secretaries. We try to do like a morning huddle where we go through the day.
Mhm.
Um, and we so yeah, so that usually happens in the morning.
Okay.
um, we try as much as possible to avoid having to do very big procedures late in the day. We try to do them a little bit earlier.
How come?
um, it's just because it's a heavier, well, for heavier procedures, we want to try and keep it. If there's an emergency that comes at 5 o'clock, we will treat them. That's not the
Okay.
issue. We typically try to keep the more like the bigger procedures that require more energy,
Mhm.
more time earlier in the day.
Yeah.
Um, and this could vary, yeah. So let's say I'm doing a lot of my work is restorative, so I do a lot of fillings, a lot of we do some root canals, um, crowns. That's all in these work.
Yeah.
Some consults, and typically, so the dentist works with the dental assistant, seeing a patient, and then we have to usually do we usually have to, so you mentioned dental hygienist. So the dental hygienist usually needs after every, we call it, after every cleaning, we have to do what we call an exam. So we have to go and see the patient
Okay.
and like basically just supervise what the hygienist did and diagnose any caries, any pathologies, any abnormalities.
Okay.
So, it's a dance between my operatory and my
It's a busy day, right? It's not like you're going to become a dentist and you're going to be sitting with your feet on the couch and that's it. That's all. The
no, no,
money
no.
comes in. Guys, it's a busy day. It's a busy day, and sometimes you lose track of things, right? You got to be organized, right?
Yes, yes. Sometimes, so I'm known to do my charts, so my charting or my dental documentation. We should be doing it directly after every patient. I'm known to keep these for late in the day because we get so busy jumping around.
Yeah.
We also get phone consults, right? People, and we really we encourage our patients to call us if they have any issues. So when they call us, we usually try to get back to them. We sometimes have to deal with pharmacies or pharmacists for whatever prescriptions or questions. And
Yeah.
yeah,
We have a question. Is Listerine Zero a good alternative?
Listerine Zero is a very good alternative. So it's zero because there's no alcohol. I also believe, so I think it is a good alternative.
And also, Maria Coluccia says, why do dentists recommend mouth guards?
Yes. So mouth guards for so there's a difference between mouth guards and night guards. I'm going to talk specifically about mouth guards. Mouth
Mhm.
guards are used for contact sports. So anything ranging from soccer to football to hockey. Um, it is not true. They do not prevent concussions because a lot of people think that mouth guards prevent concussions. They do not. Mouth
Okay.
guards, what they do is they protect the teeth. And sports such as hockey, you could just imagine it's a very big risk, dental risk, when you're playing hockey. So
Yeah.
typically people get mouth guards to protect their teeth.
Interesting. Listen, Laura, how does aging, and a lot of people here are past 50, so how does aging affect our teeth?
So aging, in terms of tooth structure, so let's talk
Okay.
about tooth structure. So like I said before, once your enamel is worn away, it does not come back. There's like we cannot recreate enamel. So there's a certain thickness of enamel that usually ranges from person to person,
Mhm.
and that thickness of enamel with aging you sort of wear it away with brushing, with grinding, a whole bunch of with like habits such as biting your teeth, biting your nails. So the tooth structure, that's one thing. There's your enamel starts to wear away. Your enamel is the white part of the tooth, right? So once it
Okay.
becomes thinner, we see more of the inner part of the tooth, which we call dentin. Dentin is more yellow. So uh, so dentin is more yellow. So that's why when we age, our teeth tend to get a little bit more yellow because that enamel becomes thinner and we see more of the dentine inner layer of the tooth. Then we look at the gums. So gum disease is not age related,
Okay.
but with age, there could be trauma to the gum through brushing, through years of traumatic brushing, through undiagnosed gum disease that it just
Wow.
ravages the teeth.
Hmm.
So with age, typically we have more, and it's not a cause and effect, right? I'm just saying that with age, usually we get more gum issues.
Yeah.
So we have like what we call receding gum line.
Okay.
Um,
Like
so
a receding hairline.
exactly.
Maria said, "Why do people develop dropping?"
That is a very so dropping could be caused by different things. It could be caused by so we have what we call the TMJ joint, so the temporal mandibular joint. So that could cause pain. There's
Mhm.
also dropping could also be caused by trauma. If somebody's in a, like I mentioned before, a contact sport, sometimes you could have undiagnosed jaw fractures. That could, like, if they go undiagnosed, they could start causing problems. Dropping could also be caused by several pathologies. That's why we also recommend X-ray, like a panoramic X-ray. So there's different reasons. It could also be a grinding habit that causes joint pain, and joint pain we sort of group it into the jaw pain.
Ijana says, "Do you have a favorite treatment that you like to perform?"
I really like seeing kids. I love the um, non-predictable aspects of treating kids.
Interesting.
Yeah.
Maria said, "Why do teeth become loose?"
So typically, teeth become loose. So when we're looking at kids' teeth, baby teeth usually become loose because they're being resorbed and there's the adult tooth growing underneath. But so that's a normal, it's not a pathological state. There's certain pathologies that cause teeth to become loose. When we look at gum disease, for example, gum disease, there's bacteria that wear away at the bone,
Huh?
and also where cause inflammation. So there's inflammation and bacteria that cause um, the bone to become worn away, and that
Mhm.
could cause teeth to become loose.
How do we prevent that?
How do we prevent loose teeth?
Yeah.
Um, Regular dental visits.
Hmm.
Also, oral hygiene.
Yeah.
I can't stress this enough. Flossing. Flossing is very important because we want to go and make sure we floss between the teeth to remove anything that could cause any inflammation. And just your regular, like I said, the regular dental exam, where we could, measure your gums, measure, probe, and see if there's any areas of inflammation that we should be aware of.
Okay. And
And
how many times a day do we brush our teeth? Is it once in the morning, once at night? Like how many do you brush your teeth? How many times?
we should be brushing our teeth twice a day.
Twice a day. Okay.
Uh,
What's the recommended time? Once in the morning,
Once in the morning and once at night.
and once at night? Okay.
The nighttime brushing should be very thorough because
Okay.
we want to remove any plaque. Because when we fall asleep, there's bacteria just harbors there while we sleep. So we
Yeah, of
want to
course.
avoid. We're not like during the day, for example. Uh, you have like cleansing habits. So you have salivary flow. You bite into things. So your mouth is like cleansable. But at night, we're like in a sedated state where our salivary flow decreases substantially, and the saliva doesn't get there. So there's very little self cleansing. So we
Okay.
want
So
yes.
so every food has bacteria in it. Is it like meat has more? Or like how does this?
No, so bacteria, our mouths have bacteria, that's not the issue. Just the pathological ones, the ones that cause decay. Some
Mhm.
people, so when we talk about risk, some people are just are typically have a higher pathological bacterial count that causes more decay than others, and they're
Okay.
more virulent. And we don't actually there's a lot of studies into this.
Yeah.
So we look at agents such as xylitol or fluoride to look at counter that virulence of bacteria.
Interesting. Now, this is a big question. A lot of people are thinking of getting them. Some people they're avoiding it because of the price. It is expensive, right?
Yeah.
Why would someone get orthodontic braces?
So most of the times, people don't typically. The reason they think of getting ortho is mostly for aesthetics. So, and it is a very aesthetic procedure, right? There's other issues there too. For example, if we try to place teeth in the ideal position, we
Hmm.
have the right amount of, for example, even like for gum, some people have gum issues because when teeth are chevauché, what's the word?
Crossbite.
When they're, no, not crossbite, but when they're like, okay, for lack of better terms, when they're crisscrossed, for example, or in a bad position, it could cause a buildup of plaque and bacteria, and it increases the risk of cavities, but also the risk of gum disease, of gum issues in that area. So by placing teeth in what we call an ideal position by getting orthodontic braces, we're sort of avoiding that, right? We're placing teeth in an ideal position where it could be cleansable, so they could brush, they could floss, ideally, and yeah, and
Interesting.
yeah,
Maria said, "What are the advantages and disadvantages of silver fillings compared to white?"
yeah. So silver fillings, what we call amalgam fillings, have gotten a very bad rap recently. Not recently, but in general, people don't like them. They're silver. Why do I need to have silver fillings? I want to have the white ones.
Hmm.
Silver fillings actually have um, an anti-carry aspect to them. So typically, the long-term amalgam fillings can actually last longer because
Hmm.
they prevent the recurrence of cavities when at the junction between the tooth and the filling.
Okay.
Whereas the junction between the white filling and the tooth is not as strong.
Okay. Also, Levko said crowding equals
Crowding.
chauvache.
Yes. You're right. You're right.
What is he talking about? Is he talking about the teeth when
Crowding. I was
when they're
talking.
too close? That's
Oh,
crowding,
yes,
right?
exactly.
Okay, interesting. So, what causes dental pain? Like we were talking about jaw pain, but what could cause any other dental discomfort?
So dental pain could be caused by a lot of things. It's happening a lot, with, especially in areas and this time of pandemic or high stress. A lot of people have, and this is people could look up this article in the New York Times.
Hmm.
Uh, there's a lot of people who've been clenching, right? In periods of stress, we have a
Yeah.
tendency to clench. That could cause pain, it could cause jaw pain, it could cause actual dental pain, the type of pain that mimics even like what people call root canal pain, right? Um, so typically, the go-to dental pain is usually a dental cavity that's affecting the nerve, and that's to varying degrees, right?
Hmm.
We could also talk about sensitivity. Some people,
Maria said she's impressed by how quickly. Okay, she said, "I'm really impressed with you and how quickly can I get with an appointment? What is your telephone number to reach you?" So, guys, real talk. If you're interested, listen, Laura. Could they just book an appointment? Like, how does it work? Is there a waiting list? Like, you know what I mean?
we try to get typically the new patient exam, the new patient appointment is a pretty lengthy one. We try to have a very long discussion with the patient. We try and diagnose everything that there is to diagnose. It's a lengthy appointment. The reason why I say this is because longer appointment, we sometimes have to. There's a delay. We can't get it within the same week. We
Yeah.
sometimes have to go a little bit further just because it's a longer appointment. We like to really get to know the patient,
Okay.
and we like to diagnose gum disease and any gum issues, and so that appointment is typically longer.
Okay.
So we have to find a long enough slot to usually do this appointment. But I will be sharing my phone number some it's a question.
Actually, guys, what I wanted to say is that the link to the website for CLINICO DENTAIRE, which is the building where you work at, all like if you click that link, all the information is there. I
Yes.
believe the number is on there too, and also if you go check out my Instagram post at the Ange TV show, the post that I made, I actually tagged CLINICO DENTAIRE. So if you click that, you're gonna get the number, you're gonna get the address. I believe it's on Jerry, right, in Saint Leonard.
It's insane.
Next to where's it next to exactly? The Flirts, right?
Yes, exactly. So it's almost at the corner of Gil and Jerry. Jerry East.
Yeah. So all the information is there. Also, you could even click on Loretta Runs. Is there any information on that page, Laura?
No, but I should. I'll be updating it after the episode. I'll update
Yeah,
it.
you could send a DM at Loretta Runs. That's her personal account if you want to
Yes.
book an appointment. And like I said, the actual Instagram page is CLINICO DENTAIRE, right?
Yeah. Yes.
So all the information is in the description. If you click the link, it's going to take you there. It's going to say how to book an appointment, information, all that great stuff. And listen, Laura, you've been amazing today. Seriously, round of applause for you.
Thank you for having me.
You look like you wanted to say something, Laura.
No, I was just gonna say it's better to reach me on my personal account.
Okay, no problem. Listen, Laura, is there any upcoming projects down the pipeline? Maybe public speaking, some kind of teaching, some kind of maybe YouTube channel, some kind of like I don't know, personal concept like.
For the moment being, I'm trying to personal projects. I'm really looking forward to running this marathon in September. I'm doing a lot of continuing ed courses. I really like learning, so I'm trying to once the borders open up, I would like to go do some continuing ed in Florida. In terms of other projects, yeah, I think it's become very big, on Instagram. I think there's a big educational aspect to Instagram, and I think I should be using it a little more. I want to start my own page, Instagram page, dental page, give people information about me, about dentistry in general.
I highly suggest you do something with it, Laura. Seriously, you know a lot about it. You should either do a YouTube channel, or maybe, like I said, maybe an Instagram page. Do something with that. I understand there's this thing about celebrity status and everything and privacy. And like that's something that a lot of people it's like when you're very active on social media, you take it for granted, the privacy and everything. You know what I mean? So it's something you really have to get used to. You know what I mean? You got to get used to like pretty much everything. Like I didn't ask you a question about criticism because like you're not really like an entertainer, right? But I usually ask the people that are like entertainers, social media, bloggers, whatever. I ask them, how do you deal with criticism? So it's like, and that's what I wanted to say. There's always going to be criticism, good or bad.
I actually really it's strange to say, but not necessarily criticism, but sometimes patients will bring up something that they never thought about. Because we've been so trained in a way of doing things. Sometimes like we take for granted what we know.
Yeah.
And for someone who has, for example, somebody who has their first filling, they have no idea what a filling is, or so we get a lot of questions, and I enjoy it. I enjoy their questions. Sometimes we get critiques. I was a little bit sensitive. You have to take the good and the bad, and the criticism is also as
like I'm sure you get criticism. Like it's as if you're giving a haircut, right? Like they could be like, I don't know, it could be maybe a filling, it could be whatever. It could be the stupidest thing at the same time. You know what I mean? Like
what's fun is that because we have a patient, patients that we get to know them really well, and they come back and whatnot. A lot of them are open with us. They say, listen, I don't like coming to the dentist, but I like coming to see you.
Yeah.
Which is I don't know how to answer that because we're the same people, but I'm the same person, right? I'm a dentist and I'm Laura, but
Yeah. It's always fun, and like I said, it's every once in a while, so it's kind of like you're like, okay, well, we're gonna have a chat, have a good time,
yeah.
So. Also, Maria said, "Is Dr. Laura coming back?" Oh my God, that's a really good question. Listen, guys, anything is possible. Anything is possible. I'm sure Laura would love to come back, and we could do another
Yeah.
Q&A one day. We could find something for sure. Maybe even do a vlog. If I do a procedure, Laura was saying maybe you should do a vlog. That's something we could probably do as well. That would be very interesting. Like I said, the sky is the limit, guys. So I want to thank Dr. Laura Ianella for coming on. I think she did an amazing job.
Thank you so much, Ange, for having me.
It's a pleasure, guys. Thank you very much for tuning in. If any of you are coming from Laura, don't forget to like, comment, subscribe, and also share this video out, guys, on all social medias: Facebook, Twitter, the Pony Express. No, I'm not trying to copy Vic DiBattero. But you know what I mean, guys. Share it out. Tell a friend. And I'll see you guys tomorrow. Is 3 Men in a Podcast. It's a podcast with two of my other friends. Tomorrow we have Paul Loduca on. He's a great guy. I had him on. We're gonna just talk as men. We're 4 men. We're gonna just shoot the stuff, and it's gonna be amazing. Yeah, Maria said a blog would be great. I agree. So, guys, if you have any last-minute questions, you have exactly 1 minute to ask that question. If not, me and Laura are going to sign out, guys. So I'll be seeing you guys tomorrow at 3 Men in a Podcast. Next Monday, we have Power Play with Ange and T, which is a debate-style podcast. We debate hot topics here in Montreal and around the world, guys. And stay tuned for the Ange Network as well. My second channel, there's going to be a lot more content on there, guys, especially with the Euro Cup starting. We're going to have analysis. We're going to have food reviews coming up. Very excited for that. Food reviews. We're also going to play reruns of 3 Men in a Podcast because it's only on the 3 Men channel, but I'm going to have replays. And the Flash said, thanks for all the info. Very informative. Thank you, my friend. I appreciate that as well. So, guys, me and Laura are going to be signing out. Take care, guys. Have a good night. And I hope you guys learned a thing or two about oral hygiene tonight.
I hope
that's what counts.
People were able to take what they could from this.
Exactly, guys. And maybe you book an appointment with Dr. Laura. Who knows, guys?
Oh, yeah, for sure.
All right. Take care. Hey, Nick C came in the building last minute. What's up, buddy? He said, can we see Ange live getting a filling? That would be funny. Seriously. I have to figure out how to do that, but that would be really funny. Seriously. That's a good one, Nick. Anyways, guys, me and Laura are signing out. Ciao, guys.